Welcome, everyone. Just taking a moment to absorb some good vibrations while we wait for other friends to join us. My name is Bhagavati. It's my pleasure to be here. Thanks, Christy and Anna, for inviting me. You normally start right at 3. Christy, should we give people another couple minutes?
Yeah, maybe a couple minutes. Do you want people to introduce themselves in the chat? We've got a pretty good group.
Oh, if you want to go ahead and introduce yourself in the chat while we wait, just to see if anyone else will come, and maybe just give yourself a moment of like 3 deep cleansing breaths while we wait, just like detaching from anything that's happened up until this moment and just really allow yourself to land here in this moment together. Right. Well, those good vibes can be found on this PowerPoint slide that I will share with you. It's nice to see some of your names and faces and things like that. I appreciate the connections. Christy, do you want me just to go for it, or do you want to introduce me, or just
Yeah, I'm happy to introduce you, Bhagavati. Yeah, hi everybody. Welcome to the April Learning Collaborative. Really glad that you are all here and making space for us today. And Bhagavati, thank you for that vibe set. Like, didn't know how much I needed it. That was great. Thank you. And so
make much?
simple.
I
It
know.
wasn't even that much,
Mhm.
but it was really powerful for me at least. So yeah, welcome. We had initially planned to use this month's collaborative to dig into strategic planning, but SOCAC needs a little bit more time to get our heads together. And at the same time, Bhagavati and I connected a couple weeks ago, and she shared that she had been hosting some listening sessions with education partners. And felt that what she was hearing would be really relevant and of interest to all of you. So we are going to pivot today, and Bhagavati, thank you so much for making time. I think some of you have worked or met Bhagavati before. If not, you can share a little bit more about yourself. But Bhagavati is here and going to talk a little bit about her work at Department of Education and help kind of facilitate some conversations about how we can nurture the relationship that regional systems of care have with our education partners because it is so important and so, I think, ripe with opportunity to improve outcomes for kids. So, Bhagavati, take it away. Thank you so much for being here.
Bună ziua, mă numesc es Adriana și sunt profesoră de sănătate. I do this for Selby Stebbins because Selby and I go back to the Republic of Moldova, where we served as health education Peace Corps volunteers in Eastern Europe about 25 years ago, Selby. So we win for the longest knowing of each other, and I still have a little Romanesque in me. So
And
um, it's
Haley is was of RPCV from Ukraine, right next door to Moldova. I don't know if we have any others in the room,
Oh,
but
yes,
yeah,
yes. And
we go.
Bhagavati is, I shared in the chat, but I am the president of your fan club. So anybody that wants to join, just let me know.
That's funny. Well, it's my pleasure to be here. Christy and I go way back, but then when I'm looking here, I'm like, oh, sorry, Christy, Selby and I actually go even further back. So I would be remiss if I didn't just bust out a little bit of Romanesca to start things off in a little spicy way, because that's kind of how I roll. So, yeah, I'm super thrilled to be here. I am going to just share a little bit of background about the listening sessions, like Christy mentioned, a little bit about myself and my unit, and then really just kind of after sharing some of the results of what we heard from the listening sessions, just hold space to kind of learn from you all about how partnerships are going with ed at your local area, and to kind of see if there's things that we can maybe lift up to kind of do some peer-to-peer sharing here, or maybe to address some barriers. And so maybe we can do a little bit of technical assistance, and just ultimately to offer, myself here in service to try to help make these connections. So I'm going to go ahead and do a screen share again. And I didn't even like mock up this. You can see my slides, Christy, yeah? Okay, so this is basically, I'm just going to give you the gist of the beginning, and then I'll dump this slide deck in the chat so you can see kind of what happens at the listening sessions. But so this is the deck that I used, and this was kind of the flow. This was a partnership between OHA and ODE, and it was really, designed in the name of like CCO procurement is forthcoming, and how can we make sure we engage school, where like a real significant number of those OHP students are during the day. And so really important kind of intersection to the two audiences of these two programs. And so then this was just a quick little background on this unit that I am working in now and have been coming on 2 years now. So the Health and Education Unit is within the office of the director's office here at ODE, and we are a small but mighty team. And Arden is also here with me today. So thanks, Arden, for being here. And yeah, we are kind of, like I mentioned, kind of uniquely positioned in the director's office, and we're kind of at the intersection at all of these various health initiatives that exist throughout the agency. And so kind of we're tasked with trying to build some cohesion, not only internally within ODE as it relates to all these common threads, but also kind of between agencies and between organizations such as the coordinated care organizations. And so that's been one of my passion projects since coming here, in this idea of kind of building cohesion between ed and med, as I like to say. I came to ODE. I was at DHS for 1 year in a job rotation, but prior to that, I worked for the Transformation Center for 7 years, where I was really helping to support the work of the community advisory councils and providing a lot of technical assistance as it related to the CHA and CHIP work. So I come to this position kind of uniquely positioned to really try to help move the needle on some of these really important local partnerships. And yeah, so I think I won't go there, but then of course, just like I did with you all, I had kind of course, at this time with this group, just pause to give them a little box breathing. If you want a somatic toolkit with all of these resources that I've compiled in the name of creating like a culture of well-being, I am happy to share it with you. It's a Google Doc, it's open. I go in there often, and there's like anonymous, armadillos in there constantly, or things like that, because people are using it. I don't know who they are, but I'm happy to share. And ultimately, the reason I went there is because, if you know anything about the polyvagal theory, there's these 3 different states of kind of our nervous system, and they really impact our ability to be socially engaged or completely shut down. And so similar to the youth that we're trying to kind of do all of this important system level work for, we can't do this work if we're shut down. And so it's really important to take that time to take care of ourselves so that we can be regulated and do this important work. So I'm always remiss if I don't try to make a pitch for the importance of workforce wellness. So consider that a check. Anyway, so this was really designed to help to listen to the schools. We had partners from school districts and education service districts, and I can even send you the registration list that shows you all of the different kind of, it's redacted, but it shows kind of the different positions and the levels of ed engagement that were in these 3 listening sessions. And I won't go so much over this now because this actually may all be changing. But then what I had done is I just provided basically like a CCO 101, because similar probably to the CCO world that could probably benefit from like an Ed 101. The eds, like one of my jobs here in this unit has been I've been saying to school ed in CCOs, right? Like how can we teach education partners about what CCOs are and how to have these on-ramps to kind of find this alignment. And so that's what I did at the listening sessions. And I'm not going to do that with you all now because you all know that really well. But I would do want to just kind of skip forward and, like show you that like there is obviously this intersection, and this ESD map kind of shows that. Actually, I want to go back just a few slides to just make this point about if you need any data points that kind of show like how aligned, this OHP population. This slide is a good one that kind of shows you obviously have that data, but I think some of these stats that the number of enrolled students by Medicaid are pretty profound, when we look at some counties being 75%. So yeah, then that was basically, I just want to do an escape here so I don't have to go through all the slides of the CCO 101, but I'm happy to put this, to share this in here for you. And then I do want to just go to, so you have that here now if you want it. But, I just kind of want to show you the questions, aside, from like, yeah, so these are the questions that we were like looking to have them. I went through the CCO 101 really quickly, and hence the fasten your seatbelt and reminder to breathe while we're inundated sometimes with a lot of information all at once. But then these are the questions that, I'd like to kind of repurpose for you all today. Before I do that, I'll just pause real quick and see if there's any questions about kind of who I am and what I'm talking about here together today before I pull up another document that I'd love to share with you that, I think Anna and Christy, I think you have that follow-up email. If you want to just forward it along to this whole group, it's all public information. So I'm happy to have you do that. And I'm also just to kind of pull up some of those documents right now on screen share. But if you want to forward that email, that is fine. So anyway, before I switch gears to kind of showing some of the input and feedback, any comments or questions thus far? So you're still with me, Christy. You can see now this Excel document that I put in front of the PowerPoint.
Yes, it's kind of small. And Bhagavati, there are people attending here that I might not
Okay.
have like readily available email for.
Okay. I mean,
So
I can.
if
I
it's
can-
important to see that email you're referencing, it might be best to pull it up and share it.
The email.
Yeah. Or if it's not that important, then I
Well,
can.
I'm just going to forward it to you again here, and look at the email before you just forward along because I might have, yeah, CG member email was in front of it. But anyway, I will show all of you right now the attachments and the things that are in that email. But then, Christy, if you want to, because people forwarded the invitation to get people here. Is that the situation? Okay.
Yeah. Yeah.
So basically, at the end of that PowerPoint is my contact information. So if you are here as a guest, thank you for joining the conversation. And if you want me to forward you the email with all the things so you have them, email me and I'll hook you up. Okay. But in the meanwhile, I'll go through all of those and you'll be able to see them. But if you want them in your inbox, you just have to hit me up with an email. Good plan?
That sounds great.
Okay.
Bhagavati, how many people in total did you have across the listening sessions? Like rough number?
Yeah, 1 second. I'm gonna open up the other document here, and I feel like we had around 75 between the three, but we had more than that register. Um,
You want to make that bigger? It's pretty small.
yeah. So this was just the 319. So let's see, 313, we had, we had 78 people register. 318, 56, and 319, 51. So we had a lot of people register. You can see kind of some of the organization types. So we put that into some charts. So you can have a sense of, we asked a couple registration questions just to have sense of organization and like up front, are you partnering with, the CCOs, just to kind of have that at a glance. So that gives you this document has all that information if people want that. And like, as you can see, there was also some qualitative documentation that thanks for doing a little acronym soup situation. But this document also has some qualitative, in the registration for the listening sessions, we asked some qualitative questions. And ultimately, yes, you can go through with this with a fine tooth comb if you want. And Amanda Braxton, amazing OHA colleague, basically synthesized everything into this document that now is in front of you right here. So this school district input document gleaned what we kind of captured from the chat and what we captured from the conversations and from the evaluation questions that I will also put the link in the chat because that was it's really kind of amazing what you can do with 3 screens in this virtual realm these days, right? Like we're just like, okay. But this document that's on the screen shows some of the recommendations. Is it big enough? Christy, can you see it? Should I go a little bigger?
A little bigger would be great.
And then I can just go over here. And then, so yeah, I'm just gonna like practice my box breathing and just stop talking for a minute to give you the chance to go through this line by line just to see.
Yeah. Would it be helpful to filter maybe by category, or I don't know what the other one is?
Filter for what? I mean, I
Like
feel
organize them. Like, so category, yeah, and like listed A to Z or something. I don't know. Maybe that doesn't matter. I don't know how these are I don't know what the number is.
No, the numbers just like how many numbers of recommendations got synthesized. So don't worry about the numbers. I think
Oh.
just go for the qualitative information. You can see how she categorized it, but that's also just like her kind of working it. But I feel like it's, if you look at line 7, for example, school districts can connect with the system of care to help facilitate deeper conversations with the CCOs. Like that was like it didn't even get categorized, but it's like something you all know as an opportunity. But anyway, I just want you to see some of the things that we heard. I think leads its way to an interesting conversation point for the ESD. For here today, like to what extent y'all are working with the ESDs.
Mhm.
I also think this recommend the merging of metrics, line 17 is pretty interesting potentially for you all. SOC again in line 24.
Yeah, I'm curious about the CIE, the role of the CIE, and to what extent schools and CCOs are plugged into those things.
There's a whole conversation we can have there, so let's just pause a sec. Yeah, so that it's not that long. Other comments or questions? Did you feel like you got to bathe in this a little bit? And again, if you want it in your inbox, let me know. Should we move on from this and just now kind of go off screen share and just have a conversation about what you're seeing here?
That sounds good to me.
Okay. Just need one person to comment. That's helpful. Okay, so stop sharing. Move this. Stop sharing. Okay. So Selby, first impressions from this.
You know, one thing that struck me as I was looking through some of their suggestions, I feel like are things that as a system of care coordinator, I would actually say the barrier to that happening is on the education side. But I feel like the comments, at least from the people in your listening sessions, felt like the barrier was on the CCO side.
Mhm.
So in other words, like I know we've had barriers about how hard it is for therapists to get into the educational settings because the schools are tightly controlled environments. Everybody needs background checks. Therapists can't get on the school. And yet there was something, there about the CCOs need to provide incentives for providers to show up and provide mental health in the school setting. So there's obviously some kind of disconnect on whose side the barrier is. So I just thought that was interesting. There were several things there, and I thought, well, we have always considered that an education block, not a block on our side. So
Mhm.
those anyway would be interesting to identify those and drill down, I think, on some of those.
Yeah, and I think that we should talk about this whole concept of education block, right? Because if there are these barriers that you're all experiencing, how can potentially me and or our unit help to support breaking down those blocks, right? And like I know Selby, for example, came recently to um, we are Arden and our unit has some SAMHSA dollars, so the Substance Abuse Mental Health Agency. Maybe there's a substance use in there in that acronym, but everyone's tracking SAMHSA, and we have 4 school districts in Oregon that have these community care demonstration projects that are happening. And, there's a great opportunity to kind of leverage the connection between the work of these community care demonstration projects and the systems of care. And I know that Chris and Haley and Selby and myself, and there's one other that I've been trying to kind of help make these connections and not to much avail. But it's confusing. And I think Selby, when you talk about the block, and this part side saying they need to do it, and this side saying they need to do it. I think and I'll graciously thank Arden for pointing out, I think it's a testament to overwhelm, right? And so it's like, how can we at the system level try to help break down some of those barriers and allay nervous systems that are like probably pretty freaking frustrated after X amount of years of trying to like make this alignment to no avail, right? So how can we potentially come work this out together? Um, so Chris, yeah, I know tell me how it's going, and please.
Well, I want to say that we make contact, right? And we have conversation and we invite to our systems of care meetings. And the initial conversation, we are the CCO. We are the ones showing up individually, doing having the conversation. I am. And then they're like, well, you answered our conversation, you answered our connection, and they don't come to meetings. They're like, peace out.
And it took us a while to like get Lake to understand like how that what the connection is, and it's definitely a learning curve. And yeah, it sounds like okay, my needs got met potentially, and so now this partnership isn't necessarily serving me, and so peace out, right? And what was an interesting discovery that we had with Selby and HSD just recently, was that, y'all are mandated to have Ed at the table, right? But Ed isn't mandated to be at your table. And so what was a really cool, interesting thing that we discovered, it was like, yeah, and Hillsborough has this table that they organize at Hillsborough School District that has this table. It's like, can you like knowing that, I mean, I know everyone's overwhelmed, but like, is it possible, Selby, for you to come to this table instead of expecting schools to come to that table? So then there is still a liaising of like system worlds, but maybe the onus is on the system of care if they have the capacity to go to that table versus expecting Ed to come to this other table and like, because they're not all like the system transformers that we are, right? And so it might not be, but there are the system transformers in the ESDs, right? There are like school improvement, population improvement staff and other staff that are more at that system level than, I don't know.
But to your point, I think that's part of the challenge is the nuances within the school system. Like we talk a lot about schools, but staff in schools, yes, don't have time or contracted availability even to do this additional work. Teachers can't leave classrooms in the middle of the day to do a system of care activity. And so it's really looking to our ESD partners who have those special roles, or sometimes administrators if they're willing. But I think like we ground the conversation with the education system in the schools a lot, and I would question if we should be grounding it elsewhere within education, whether that's in your director's office or like we were saying, the ESDs or the administrators and the principals who were there, all summer, but that conversation should be grounded maybe somewhere other than the school, if that makes sense. Possibly.
I also want to add to that, and Selby, you could probably speak to this a little bit as well, is that it isn't just one table that we're liaising to. It's a bunch of tables saying, well, we've already got this group. Can you come? And can't tell you how many requests I get. And Selby's got a much, like I've got more geographical area, but Selby's got more just people, right? And so it's like 10 tables that are like, you come to us, and it's like, well, if you're looking at it from my perspective, we are one table. We want to invite everyone to. And they're like, no, we'd like you. So for like Cradle to Career, which is education and early learning hubs, and there's just, the number just goes on.
I am listening and I'm simultaneously like, I don't want to miss some of this important stuff. So I'm just want to check in with like OHA and like, is someone taking notes? Or I thought maybe I should start a Google Doc and maybe we can all just like start putting things onto this page so that we can, if that works. Haley, I see your hand raised. Give me a minute to get this Google Doc ready and I'll get it in the chat.
We can totally do a Google Doc, Bugger Buddy, but we are also recording and taking notes, and we can get you a copy of the recording. We don't post oh no, this is Learning Collaborative. We post these recordings, so it will even be up on the internet for you to watch if you want to come back and get vibe information or whatever. Like this is 100% stored for posterity, however you want to use it.
Okay. Well, and we have this now open, and so I can like get some questions in there, but like we just went for it right away, and I was like, this is great. And so thank you for letting me know this will live on in perpetuity, however you say that word. But yeah, like I feel like we're going to be doing some addressing of some barriers, and yes, Chris, like from the CCDP standpoint, which only involves 4 school districts in this state. So if you already have ideas and you want to put them down there just to capture them for me to take back to Ed, go ahead, have at it in that Google Doc. But when I originally reached out to Chris and to Selby and Haley, it was because there was and the fourth one. Who is it, Arden? Who's the fourth SOC that I'm forgetting? Lake, Hillsborough, South Lane. Who's Phoenix Talent? Who's Phoenix Talent SOC? Because we could put me in touch with Katie, and that wasn't the right thing, but it ended up being a beautiful partnership between Katie Lyon and myself.
So Katie has left.
Jackson County.
Taylor. Oh, Jackson County. Oh, sorry. Tracy.
Probably Darren, I think, was at those, though, not me.
Okay, that's right.
Yeah.
So anyway, originally there was like an ask of SAMHSA for the CCDP to establish this like advisory board. And it was like, as we started working with the districts, it's like, don't establish another advisory board. Let's get you to this other advisory board. Yes. And so then I tried to work with Chris to like, warm handoff to the school district staff who was going to have to get this board together to say, can she just come to your board meeting and present on this CCDP work on a quarterly basis? And like, I don't know if that ever happens. Like, I think we were.
Yes, yes, it did happen.
It did. Yeah. And so how was that? Was that like interesting for the SOC to learn about some of the school's work?
Yes, I think so. I think it would be beneficial if they were a regular attender,
Mm-hmm.
but yeah.
Yeah. I'm gonna just put some themes in here because we start. I think it was an ed block, or I think it was block or something that the word that was used. But I'll put in this document like barriers to collaborating with ed, and then maybe we can also just have like ideas for solutions to address barriers kind of thing, right?
Well, and just like you did the CCO 101, I mean, there's a whole philosophy behind system of care, and it's this idea that there's value add in us collaborating. But I think a lot of times people just think it's the name of a committee or just like kind of one more random committee out in the community, but there's actually a very intentional thrust behind it and overarching kind of perspective most of us are taking to it. And so again, if there's a way where we could show how the values of our framework could align with the values of the education system maybe, and how, so I appreciate, your comment earlier about, can you sit at their tables? Can they sit at yours? And, and per Chris's point, we are happy to try our best. And I said, yes, I already made a commitment. I will go to Hillsborough. I didn't even know that table existed, for example. But on another token, again, since system of care is, again, this kind of statewide initiative to have all of these systems not be so siloed, like using it as a central, I think they're at the risk of system of care sounding egotistical, I think could be value in system of care as serving as the convener and the connector and the silo breaker. And so, yes, I'm happy to go to Hillsborough, but also if the invitation could be more broadly understood of how system of care is trying to blanket and bring alignment and, coordination. I mean, it's called children's system of care because we want the siloed systems to effectively function as one to the extent that they could, right? So anyway, I'm just trying to say maybe there's a way to connect our values to make the collaboration seem more meaningful, and it's not just some random committee that's trying to pull on our already exhausted education partners, but that there's larger long-term goals for it.
Well, and I would love to, I'm curious if anyone here has done like a SOC 101 or something. Like, is that something that exists? It sounds like yes. So I would love to invite all of those, what did we see? Like 125, 50 registrants, maybe. We could say, hey, want to learn more about the systems of care? We've got this team and this PowerPoint ready to go, and we can then re-invite them to come and learn about the systems of care. So if that's a solution to address a barrier of just not understanding how that works, and if any of you are interested in spending some time to present to Ed that, I think that would be a great service. Okay, so then I'm seeing thumbs up from Chris and Selby. And so, like, should we just kind of try to work off behind the scenes to find a date to do that and just put it out there and go for it? Okay, so we'll make that a to-do, for Bhagavati to connect with Selby and Chris to land a date for a SOC 101. Okay. What else? Hi, Anna.
Hi, had a hard time finding my mute button. I think I'm more in a solution space than the barrier space. I've been having a lot of conversations with people up and down the sort of the layers in education, right? Like frontline teachers, classified staff, all the way up to like ESD administrators, about the challenges that they're facing with behavioral health access coming into the school space where kids are overstimulated and struggling to maintain sort of their behaviors in school in a way that creates a learning environment that other people can participate in as well. I know that like in my region, which is the Gorge region, there's a behavioral health provider who's trying to create contracts with the school so that they can come in and be more supportive in a therapeutic way. And we have some peer providers in the schools already that are doing some of that work, right? But I think there's like a value proposition to schools about how system of care can help them connect to the right types of providers for whatever those challenges are that they're facing in their schools. Like they're aware that kids who aren't accessing appropriate IDD services are also struggling in their schools, right? But it sometimes feels like they have to solve all of those problems.
Yeah.
And so offering the system of care as a resource to like, if you can get somebody from your school to come to this table, we can help you find who your right partner is and continue to facilitate those broad connections, because your right partner today might not be the partner that that family who's struggling in your school needs tomorrow or next week when it's a different family who's bumping up against a challenge. So I just feel like the value proposition to me is so clear, but I feel like as we've been trying to kind of put that out there, it isn't sticking in those education ears in the way that we feel like it may be that we're not saying it the right way, we're not using their language or whatever, but I feel like it's like the sell should be so easy. Like you are craving this and we are offering this. How do we connect?
I love what you're describing, and I'm also like all of a sudden envisioning like all of us co-creating, or all of you. I don't know if I have the content at this point. So if you choose to accept this mission, like sovereign beings that you are, like perhaps we start building a slide deck that has a case study. Like each of you, if you've had success um, with this, showing the values, at like having an example that like in this school, this is what we did, this is how it looked, and this is the outcome, right? Because we had this. So if you have had a success story that like documents that, like throw a slide in this PowerPoint to illustrate it. Let's build some case studies as we go through this conversation, or after, right? We don't have to do it now. But I just see like with this value, like knowing how a story can really capture that value. And obviously FERPA, HIPAA, all the PUs are going to get in the way of us using like real like data, like names or what have you. But we could totally capture the story without doing that. So I invite people to build a slide in here if that resonates.
Love it.
Haley, see your hand.
Yeah, I really wanted to echo what Anna was sharing and kind of share some vulnerability with folks. Obviously, I've drank the system of care Kool-Aid. Like I'm a fan, big believer, makes sense to me. And it seems to not always land, right? So I think that's what I'm understanding, Anna, that like you're sharing too. It's like it should sell itself. And so when I first came on board, almost 3 years ago, y'all, in this role, I was connected with all 16 of our districts. I think it's 16, and I connected to somebody from each of them. Granted, it wasn't necessarily like the superintendent or anything like that. It was like, the director of something or psychologist. Everybody was like, yes, love this. No, I cannot attend. We'd love to have you come and present. And so, like a few of those and things like that. But I have to draw a parallel for us, at least in Lane County, we similarly encounter this with our juvenile justice system, to where it's just obviously not to the degree and breadth of how big our education system is, but it's just very siloed. And the feedback, and I appreciate the honest feedback our juvenile justice partners have given us, is just like, doesn't really feel like there's much for us there. Like our time could be better spent elsewhere. Excellent feedback. And at the same time, in the SOC coordinator role, and if you're lucky enough, like some of us who have like, teammates or, a very involved supervisor, you try to accommodate that. Adding one more layer there, Lane County unique in that I'm not embedded in a CCO. I work with both of our two CCOs, and I'm a government employee. And it feels like this is kind of like a twofold messaging, right? Like we want to get in with our education partners and really kind of sell what the SOC is and how it could benefit them in the same way that we want to with our juvenile justice partners and everything like that. I sometimes don't feel like our CCOs, or at least maybe I'll just speak to Lane County, in which huge fan of my CCO partners. This is on tape. Love you guys. I don't feel like they sell the SOC, right? Like they're in some of these meeting spaces, but they're not selling that like, oh my goodness, you should come to the system of care. This is this is something that they're working on or could work on. And so that's a piece, like speaking to what Selby was saying about how there seems to be barriers and thinking that it lies within the CCOs or versus the education, like kind of there's work here for everybody to do. So I'm taking a lot. I meet with both of our CCOs for these quarterly collaborative meetings where we come together and we're really like problem solving, or at least I'm trying to problem solve and, get them at the table. And then I've had a lot of word vomit here, but I'm gonna throw like one more piece to it. And that's just, I wonder if it would be helpful for us to think about in our materials, and I'm wondering if this is something that we could all partner on, as if the SOCAC needs one more piece of work, or as if any of us need one more piece of work. But it's almost like for those outreach flyers or things that we send, they almost need to be a little bit more targeted. And going to the idea of these slides that speak to these case studies, it's almost like I would want to share the successes of some of these barriers that have been escalated to the state, or like where things are at. And it'd be like, okay, this is a flyer that I would give my juvenile justice partner so they could see, like, we're doing this. We are working on juvenile justice stuff. Or, hey, we're doing education work. That's just my 30 cents there.
Oh, I usually say 50 cent. I like it. 30 cents. Good work. I want to hear from the other hands that are raised, but I also want to like make sure we come back to like where's the success story here, right? Because when I've gone to like the ESDs and the superintendents and I'm like talking all about CCO 101 and I'm like, thank goddess when X, Y, and Z people in the room are like, this is going really well for me, right? Because it's like, oh, it is possible. So like, I would love to hear from the hands, but I'm going to put in the chat, like, I want us to circle back to like, who is having great success with engaging with ed, if anyone here. So let's make sure we hear from that today. I don't know if it was Heather or Chris's hand up first. So whoever, please. Heather, it looks like you.
Yeah, thanks. I mean, I think I'm with Anna in the vein of like I'm trying to think of resolution here as opposed to continued barriers because obviously it's hard. And I in Marion and Polk, we are blessed to have some school folks hanging out with us and pretty heavily engaged. Like they're very busy, but you know, we try to be really flexible around that, whether that's like sending emails to really make sure they attend meetings that actively speak to school related issues, or pinging them on the side asking, have you heard about this issue? What can you tell me about it? Or can we spend some time or trying to go visit them where they're at? Obviously that takes additional time and we know that system of care across the state is a bit understaffed in certain regions. And so that can pose a challenge in itself. But I'm really curious and making notes about what kind of questions to ask my own partners in the Marion Polk region, but really thinking about what spaces exist to somebody else's previous point that we could spend time engaging in and not I love the System of Care 101 idea, but also just like taking the time to build rapport and really understanding on a deeper level, like what is important to the schools and what are their current issues. And also thinking about connection through potentially our youth locally as well. And in Marion and Polk, our youth, they all attend different schools and they've really honed in on some like school specific issues. And so I kind of wonder if that's a way to reach through and kind of sell it to the school partners and really try to bring them to the table that way, knowing that students are at the core of, their passions and their efforts each and every day. And I think another piece that comes to mind for me is also like, how do we engage the different school districts within a region also? Because while we're blessed to have Central School District in Salem Keizer, one or two school districts is only one or two school districts, and there are others that we have not been as successful outreaching to and having regularly engaged, and not wanting those partners to feel as though they can't be engaged, that we're not hearing them, because many of them are kind of more on the rural side as well. So, really wanting to make that a priority. So I don't know. That's a lot of word vomit also, but just wondering like what types of spaces we could be participating in that don't necessarily require them to come to us, because I think that has been a challenge even in the Marion Polk region at times is that there are just not extra school staff to lend to a community meeting, and we want them there. We want to hear. They always have something really great to share, and or a current issue that relates to something we're talking about. But it's hard, and it's I don't know. I personally feel a little guilty trying to continue to pursue them and ask them to step in that space when we know that they are completely strapped for time and are doing all the good work in the community, helping the kiddos of the world. So
Heather, super helpful. I started in our Google Doc, not the Google slide deck, the Google Doc, like what a kind of another header in listening to you that surfaced for me is like, what questions do we have for Ed? Right. And so then it's like,
yeah.
how do we engage with the various school districts, identify what spaces Ed has where SOC could participate? What are the current issues Ed is wanting to tend to? So if there's other questions that you, in your best, case scenario, you would have those questions answered, feel free to dump the questions there. And I also want to ask you real quickly, Heather, and that was an invitation for everybody, obviously. But Heather, are you working with the ESD? Or who are you working with? And at that way, Marion Polk, like.
Yeah, we have both. So we have a Willamette ESD representative that regularly attends and participates. And then we've got someone from the Salem Kaiser School District and then the superintendent from Central School District as well.
All right. So you've got like lots of different layers there.
We do, yes. Yeah.
Anyone else? And then again, Chris, you've been so patient. Thank you. But like is anyone else engaging with ESD and school district staffs at the same time?
Hi, this is Jennifer Schwartz, and I'm with the System of Care in Lynn, Benton, and Lincoln counties. And we definitely have a strong partnership with our Education Service District folks, as well as care coordinators who work in different school districts. They participate in our practice level work group meetings, and our ESD partners participate in our regional meetings.
Amazing. Thanks. I saw that you were also putting some of that in the chat. I was also trying to copy and paste. I cannot, but Christy or Anna, before you close the Zoom, if you could make sure we grab and save the chat, that would be super helpful. Thanks. Chris.
Thanks. I was going to say we have ESD and different schools at our table across all of our counties. Some are better than others as far as but we do have, so we have Intermountain ESD, which covers multiple counties, and then we have Wallowa, and I don't know what their ESD is called, but they're part of it, and we have different school principals and superintendent. It just kind of depends on who can come to them. So that, I think, is helpful, but one of the things, and the timer is going off, so bear with me. One of the things that I was going to say is that we decided that having this engagement opportunity has been a real struggle. Like, hey, we need to go out and engage X, like one person or whatever. So we have created our Systems of Care 101 and a Barriers 101. And we are going to start offering those at different times throughout the evening and stuff, different times throughout the month. So that anybody can pop in, and it's just going to be hey, the link will be on our website. You can just log on. It'll be the same. It'll be the same link and everything, so that anyone who has time and availability can pop on. And my whole team is just taking turns, and we're just going to go through. This is Systems of Care 101. This is the Barriers 101 as they're navigating, because engaging individually across 12 counties has been a little bit more challenging, but we're hoping we can just get people who want to just pop in and learn more and determine, is this where I fit? Do I want to know more? Mm-hmm. And we have said that we would, if people popped in, because I know Central, Deschutes County is close to us, we've also said it doesn't matter who pops in, even if you're not our CCO, even if you're not our Systems of Care, we will do the warm handoff to connect you.
I appreciate that. Sometimes it is that kind of tailored connection, and just as Jennifer, maybe? No, I'm sorry. Oh, it was Heather was describing like, oh, hey, this meeting's going to be particularly relevant, or you missed this bit, like, because sometimes it is hard getting that attendance at all meetings, and yet there are certain, bits that really do require that ed perspective, and so that extra follow-up, I'm sure is appreciated. Was also thinking as you were describing these, like, and thinking about some of these questions that we have for ed and the CCO, I'm sorry, the SOC, you were talking about like different 101s, right? Like we can totally use these questions that we've kind of started drafting here in this, Selby and Chris are going to maybe help us do this offering for ed. And we can have these questions be part of like what we can learn from the audience, right? In that kind of share. So I feel like we're going all over the place in lots of different directions in this organic conversation, but I feel like there's a lot of goodness that's surfacing. So I'm appreciating your all's attention here. Seeing other comments, would love to see funding and or administrative responsibility from our system partners, including ed for SOC work. Yeah, the other thing that's really interesting, I have a new colleague over here on my team. Her name is Remy Watts, who was at OHA and worked with Delk and did some Raise Up Oregon. And she has been helping Kati, our administrator, looking at some alignment work with ODHS, DDS in particular. And I just saw on their agenda for this Friday, it looks like Remy has put together like an Ed 101. And so I'm going to track that down at some point because I think that is like, when I see something like, there was a question that propped that, oh, we would love to see funding or administrative responsibility from ed partners. Like, yeah, we'd love it's a different beast over here on Team Ed. Okay. Like it's not, there's the authority that I am familiar with at OHA as it relates to grantees and county health and all that. This is a different system at Ed. And so I think this PowerPoint that Remy is putting together is going to document kind of the levers, like how it works over here, because it's very different. It's been a kind of a new dynamic that, what is it? The Oregon motto, she flies with her own wings. Like this is really near and dear to the hearts of ed, because we are removed, like Division 22 is the one kind of the major lever for some of that authority and responsibility for ed as it relates. So anyway, I just wanted to mention that is a resource that might be helpful not only for you all, but for myself as well, to really understand where that responsibility and authority lies within ed. Anna.
Thanks. I was just thinking, looking at our partner Gabe, who's here and he works at ODHS, right? Like I'm thinking about the multidisciplinary team structure, which has like law enforcement and child welfare and schools, right? Like they are mandated to be in a space together, and maybe we're not looking for a hammer. Maybe we want, carrot cake. I don't think people are like running to the table to eat carrots necessarily. But like there are other places where it has been figured out how to kind of force this connection, and I'm wondering if there's like lessons to be learned from some of those other spaces, like the Oregon Department of Human Services, in like, oh, when we did this, there was all this fallout, or, I'm not sure, but just like this has been tried and done in some cases before. So just kind of naming that out since Gabe's on camera, I can use his name and call him out. Yeah.
Well, I think it's similar to SOC, right? I mean, MDT is a forced activity that is not super resourced, and then it takes a while for people to figure out the roles and figure out the conflicts and understand how it's going to work. And then every MDT is really different, just like every SOC is different. I wonder about, if we're talking about target audience, like who we're trying to connect with in the school systems, in the school districts. I definitely would imagine it's a resource issue and not an interest issue. but I seem to be able to connect with a lot of, directors of behavioral services and those kind of levels of work within the school districts. They seem pretty open and eager and have time to meet with me. So I wonder if there is a common statewide kind of group that meets and at that level, that would be easier to get in and start having this dialogue with, or leverage ODHS relationships. But those are all different, right? Like in every county, but down here in Jackson, Josephine, I'm happy to have what conversations I can.
I'm gonna try to find something here. But I put in the chat in response to Haley's ask of what types of meetings to try to get the invite for, OAESD, so the Oregon Association of Education Service Districts, has their spring conference coming up in May. And I'm actually putting together a panel on Ed CCO partnerships. And Molly Haynes from OHA is going to come and listen in. But, whether you make it to my session or not, getting to that event would be a great opportunity to understand and kind of get to know some of these players at the ESD level. And on the ESD note, what I was going to try and find here, which I think I can do, is, we work closely with Kelly Hildebrand at OAESD to, on a monthly basis, just make sure our unit connects with her about all these things. And it's reminding me, Gabe, when you were talking about like, well, who are the right positions potentially? When I first came over here and I was trying to like navigate trying to understand the landscape as it related to Ed CCO partnerships, like there's these school improvement coordinators or some positions that are at the ESD and SD level that I think those might be the people that if we have these one-pager values of how this partnership helps to support Ed's missions, that could be a really good place to take that kind of thing. So if that was the question as it relates to Team Ed, Gabe, I think that we can probably try to identify that. Was that right? Were you asking about Ed, like who are the right positions at these various levels?
Yeah, and just thinking out loud, I've oftentimes sent communications out to superintendents and I get nothing.
Yeah.
And it's not, again, they're probably getting a lot of emails. Yeah. So who, right? Like really getting intentional about understanding who that is. And in some smaller districts, it might be the superintendent that's wearing all the hats.
Mm-hmm.
And so, yeah.
Right. Yeah. It occurs to me that I showed you that one slide that shows the health and education unit with all these offices across ODE, right? And one of those offices is like really getting into regional supports. And so I think that like at the central office, if like, I'll just pretend we're central office, right? Like you have central office at that level. So if I'm central office ODE, I imagine this one team that convenes their regional support teams, that would be a great place for us internally to have conversations with how can they who have these touch points with Ed help to identify the right populations as well. So that might be, I'm going to get that copied on this document, Gabe, so I don't lose track of that idea. But there's something there with the regional team out of the Office of Education, Innovation, and Inclusion, maybe it is. But go ahead, Selby.
Oh, I'm just listening to you and Gabe, and I feel like it goes back to that question I said earlier, like we're talking about where to ground the conversation. Mm-hmm. And really who to have it with. And I appreciated that slide you showed of how the director's office is connecting to all these other health things, because the education landscape feels really complicated. And so, yes, it would be helpful if there were some slides that could help demystify it, because you just gave us a link to the education school district people. Okay, well, they've got their conference, and I know the school-based health centers are having their conference, and then there's the then there's like your office and all the things you're connected to, but then there's individual schools, and then there's the many schools in the school districts. And so like, there's a lot of layers going on. a lot of, even within education, a lot of kind of special groups, if you will. Like I said, if your ESDs have their conference, OSBCH has their conference, whatever. It's like, it would be helpful to have a more full understanding of the structures, and then, yes, to kind of understand the capacity of the different people to engage in these works, right? And so, because it was helpful earlier, you said, oh, ESDs has system transformation thinkers. But I think about schools, and I know teachers are under contract that limit kind of extracurricular work they can do. And so those are two very different constraints in those two areas. So, again, and we could try to do something if it's helpful for CCOs, or in a way with system of care, it's simpler, like just hit up your local coordinator, like we're your one door access into the local collaborative. But anyway, yeah, I don't know if there would be a way in some conversation to kind of structure out key roles in the different areas of education, and kind of who, like I said, where to ground that conversation. I just feel like that keeps coming up, but having that mapped out, I think, could be really helpful for me anyway. Trying to think of a solution instead of just a barrier. Like, it would help me to understand the ecosystem that is education.
Well, I want to get back to the carrot cake, because I want to understand, like, if we could just have this question of like, what's in it for me, which is what the case studies could also illustrate potentially. But like, if I'm Ed and I'm like already over capacity, don't even have enough to like time, money to do all the things that I'm trying to do, what's in it for me to come to the SOC meeting at your local region? Somebody break it down.
Absenteeism. Taking that on as a collective goal that SOC is assisting in the lift, because the absenteeism then ties to all the other things that that we're interested in SOC. But
how do you all help address absenteeism?
We're doing a project in Jackson County within the system of care, and it's addressing chronic absenteeism. So we're doing a research project. We've gone in and interviewed all the districts in our area, and then we have the ESDs part of it as well, the absenteeism person there. We're doing focus groups with youth and focus groups with families. And then at the end, we're going to have this report out, and then we're going to try to figure out at that point, what is it that we can do as a community to help with chronic absenteeism? So that's what we're doing in Jackson County right now.
Thanks.
Mhm.
Is your hand back up, Selby? Oh, no.
Yes, me again. I'm sorry. I was just thinking I need to practice a step up and step back. I should step back here in a second. But as another concrete example, yeah, like what's in it might be different depending on the local SOC. Like my SOC, we are not looking at absenteeism, but we have a strategic goal. And one of two interventions that we've prioritized in pursuit of that strategic goal requires working with education partners. And that is, we want to make sure that local schools have the supports they need in place so they can feel confident in receiving back students who are coming from highly structured and supported behavioral health placements or developmental disabilities placements. And so, so like there, and we actually have a direct barrier on a smaller scale. Even we received a barrier from a local mental health provider who was saying the local schools don't want to take the students back from these mental health placements because they're afraid the students are going to, explode somehow in the schoolroom. And so again, we're like, okay, well, how can we support the schools to be able to accept these students back with confidence? So again, it's a different thing, but we've identified a specific intervention that we want to support, that we think will help kids from cycling, through school and these different placements, and then they just erupt into crisis. And so anyway, just another example of a way we would like to partner with schools is making sure they have the resources and support they need to receive these students back from these structured placements.
Do to your meeting. Feels like
Yeah, I feel like the barrier resolution process is a huge asset for education partners. And Selby, just I'm thinking a little bit about that email I sent you about that young person who was boarded in the OHSU hospital, and the psychiatrist there had a great plan to get that kid into day treatment, and it was the ESD and their policy that was prohibiting that youth from getting moved into that treatment because they had some sort of, process where there was another school the kid had to go to for, just kind of silly things. And that feels like what this is all about, really. Um, so
yeah,
I'm
and I'm
curious to know
curious.
how many barriers come from schools and school partners.
Well, and I'm curious, like, I don't know, not about us without us, right? And so it's like this is a great example, Selby, and who was at the table from Ed as you're deciding to come up with this goal for Ed, right? Like was there ownership from them? Is there buy-in because this was part of their co-creation?
We currently have one ESD partner, and then we had developmental disabilities partners and then mental health partners that were interested in that. But so I'm low on education representation. Obviously, we just the one ASD partner, but I also think that probably we developed that intervention idea because lots of different people were talking about the challenges of supporting their kids, whether you're a child welfare caseworker or whoever. Like there's a relationship with the school. That's the one place every kid has in common, and so all the different systems can be desirous of that, a healthy partnership. But to your point, I appreciate what you said, nothing about us without us. But so we, I think, came up with that intervention, probably lacking some educational input, but then it also will give us, having identified it, there's motivation to strive to create the new relationships.
Mm-hmm. Christy, is your hand back up? No. Okay. How are we all doing? Ready for a new breath practice? Do we need to breathe, or if people are feeling sustained here? Is this healthy? Feeling good. I was also just thinking, and I'm going to put it in I can forward the email to Christy, but I'll also just dump it in the chat here because it's too big I'm sorry, I'm dumping it in the SOC Google Sheet document. But Selby and Chris and Tracy and Haley, they're in these districts where the CCDP work is happening to really try to bring these partnerships together in the name of kind of getting the needs met for students in the name of mental health and getting them to school ready to learn. So that work, is only in 4 school districts. And the idea there is for some spread, right? To kind of illustrate what's happening and to kind of see how that model can kind of be replicated in other parts of the state. And so my team, Arden and Jeremy, are going to be hosting some webinars on the 29th and the 1st of May. And I'd be remiss if I didn't extend the invitation to you all to listen in on that. Because I think it would be a great chance to, just continue to maybe build some partnerships between Ed and this SOC world. And so the description for the webinars and the registration are now at the bottom of that document. Anna.
Thanks. Just as you were talking, I guess I'm just like wholly in brainstorm mode. Some ideas that popped up for me were in terms of how can ODE be a partner in helping facilitate those connections? Kind of, you just said we're doing some webinars. I'm like, oh, there's lots of things ODE could do, right? So like a sample MOU that schools or SOCs could use to like start the conversation, right? So that there's something that, because our coordinators, some of them are like 0.5 FTE on this and 0.5 FTE on something else. Some of them, like Chris mentioned, have these massive regions, right? They're not lawyers. I don't think any of you are lawyers. Maybe they are. And so just like some templates that people could use that maybe are in the in ed language and make sense to folks on that side, would I think be just a tool that folks could use to start a conversation. And then also just like within the community care demonstration project work and beyond, sort of like talking up system of care, just spreading awareness, right? Even if it's just that you have your little elevator speech of what, when a school district is struggling and maybe coming for TA to whoever it is. I'm thinking of like Molly Haynes, right? Of like, oh, we're really struggling with this, school-based health situation or this Medicaid situation. Like, oh, you know who your local partner might be in that? Have you figured out who your local system of care coordinator is, right? Just like that facilitation and kind of direction to like, this is a resource you may not have considered. Coming from ODE, I think would feel really supportive from the local system of care coordinator side, but local system of care coordinators, if I've put words in your mouth that you wouldn't spit out, feel free to correct me.
Well, and I'll show you. So when I went to a superintendent meeting at OAESD to do a CCO 101 to kind of have this conversation, this is the slide. You can see my slide deck now again, this SOC slide. Yeah, this is the slide that I presented. And so I don't know, y'all can rate it or tell me how you would change it if you want, but I basically just gleaned info from the website as a plug for the local system of care. And I think that something like this would be a lot more beneficial, right? Like if we could have these be built out and you all help me have some slides that really show with some pictures and some like, meaningful what's in it for me kind of thing, as opposed to just these words that of course are meaningful, but this is anyway, that's how I've been promoting it in my CCO 101 roadshow. That's kind of taken multiple turns and twists and iterations. And so I imagine that same slide is probably in that listening session CCO 101 slide deck as well. Well, we have 15 minutes left. And just, we've gone I feel like we've gotten so much rich conversation, and I feel like there's a lot of great ideas that have surfaced. I do feel like at one point I saw something about an MOU being talked about in the chat. So I kind of want to go back and you're going to find the chat for me, save the chat for me. But did somebody here actually have one? Because it's one thing for us to like come up with ed language and what have you. But if somebody's already done it, like how can we just like lift that up? So has anyone here had an MOU crafted with ed?
Or maybe with any system partner? The only MOUs that I've heard of, Bhagavati, is work that child welfare was trying to do with juvenile legal systems. So not necessarily SOC related. Anna, this is the work that Alex Salas had gotten started before he left, and I haven't heard anything about it since that. Do you remember what I'm talking about? No.
I would say that our CMHPs have MOUs to work within the schools for mental health and things like that. So I know that those exist.
Is that something that you could lift up and share? Maybe
I'll find one. Yes.
Haley knows what you're talking about, Christy. Haley, do you want to try and describe it and see if that jogs the memory in different words?
Oh God, no, I'm not going to be able to do any better of a job than Christy did, but thank you for thinking that I could. I appreciate that confidence.
It's not the POIC juvenile justice thing, is it?
No, this was specific to crossover youth and just trying to get clear among local child welfare offices and local county juvenile facilities, kind of what the expectations were when they had a child welfare involved youth who was also involved in the legal system.
Got you. I may have a copy.
But I don't recall exactly how many counties actually signed those agreements or what has happened. I think it may be a question for Sarah Fox if we curious.
well, and when I think of MOUs, from like I don't have any ed context, but I think of the SHARE initiative, and I think of like the CCOs having MOUs with community-based organizations for SHARE dollars. And so like that makes me then wonder, like, because I feel like maybe I've heard that y'all have grant dollars that you allocate. Is that a thing? Like you get a budget? And so are there any MOUs that have been issued with community-based organizations that show some of that work that might be notable here as well? I mean, it's not an MOU specifically with Ed unless you've given money to Ed, in which case let's be sure to get that as a case study, right? But anything there? I mean, there is one that Molly Haynes, we probably should have been, oh, Molly wasn't able to be here today, right?
Can I ask one question that I feel like I should know the answer to? And so I'm just going to go ahead and ask it and not wait for permission. Why is it that why is it that our system partners are not required to be at system of care tables, but the system of care is required to exist and have that representation?
Who's got the answer to that question?
My understanding is just that that's how the bill was written in 2019. It just said CCOs have to do this and these other partners need to be involved, but it didn't say ESDs need to do this or whatever.
Perfect. That's what I was imagining. And not thinking about doing anything else anytime soon, but like, is it potential that one day to change that, to like pursue changing that? Okay, cool. Cool.
I mean, yeah, like again, I feel like that's the where are the levers at the ends is that's like to understand, yeah, maybe, but that's CCO 3.0. Where's like the ed levers, right? So it's like Division 22 student investment account dollars is one lever, right? Because that's like in order for them to apply to get those, if you're tracking integrated guidance, raise your hand if you're tracking the integrated guidance. Okay, well, that might be an important thing to track into. I'm going to pull it up. The integrated guidance, you know, I'm trying to find it, but yeah, I'm just like thinking about what the on-ramps for you all would be. And that is one. Oh, I'm remembering I actually started building that version of a slide deck at one point, but this is basically an attempt to streamline some various funding threads, streams that go out through Ed. There, as you can see here, get bigger. Why are you so small? Okay. A little bit bigger even? Okay. So these following programs are all in this integrated guidance. And you can see that Everyday Matters is that attendance. And then the student and investment account is like, so it's up to what? 1, 2, 3, 4, 5, 6, 7, 8, 9 funding streams that are all coming together in one kind of application reporting process for Ed. And I guess when I went big here, I got a little pixelated. But the common elements, there has to be one that is engaged. Well, this one's engaged community. It's terrible that picture does get so terrible when it gets bigger. But you can on that page, you can see a hyperlink to that guidance document. And we've started weaving in some language to point Ed to like because they have to do a whole community assessment like kind of situation to kind of inform their applications to get some of these funding streams. And I'm like, hey, like, don't do that in a silo. Like, why don't you like shimmy up onto the community health assessment and kind of let that be part of a system alignment? So we've gotten some words in this document, but this document's like 2,000 pages long, right? And so it's like finding the needle in the haystack there. But I bring it up here because those dollars, that is one of the levers, right? Because we have some ability to, it's not a contract, but like in the next issuance of that, of those grant dollars, there could be a question. I'm just, dreaming here. How are you working with your system of care? Or like to ensure the system of care, right? So that would be something that it's not CCO 3.0, but it's something that we could maybe try to encourage Ed to have as that lever. Does that make sense? Yeah.
Bhagavati, given the decentralized nature of education, is that integrated guidance really like the primary lever ODE has over what schools may or may not be doing?
From a funding standpoint,
Yeah.
the other thing that is my understanding, and there's one more in Arden. Gosh, I know you don't want to be called out, but if you have anything to add to this, I will welcome it. But this is the other Division 22 seems to be the place where there's those kind of things that they're supposed to be in compliance over, so that's where the compliance lives within D22. I think there's like D24 is where some health services may exist. And my colleague Eli Sanders would be better equipped to give me that. But in my mind, D22 is the place where, like, if I wanted potentially things to have more authority for Ed to have that expectation, it would be like a statute change for D22.
Awesome. Great. Thank you.
Yeah, I was going to say Division 22. That's, from what I understand, basically the only lever the Department of Education has. The other lever, which is not used, is threatening to withhold state school funds, which, as you can imagine, is not a popular or widely adopted solution. But the actual enforcement ability of ODE is really, really limited.
Yeah, and I think that's what has been, eye-opening for me to learn. And I've been here 2 years, and then Remy's been here maybe less than 6 months, and that's been eye-opening for her as well. And so then that's why she's kind of putting together that Ed 101 to kind of help make sense of that for people, because once you get here, then you understand that. But we need to let people know that as well, right? What else? I hope this was helpful, Christy and Anna. I'm super appreciative of your being willing to kind of bring me in today and just kind of have this organic conversation. I guess I'd be remiss if I didn't end it on like this note where it's like, how can we just think about carrot cake? How can we think about just all the goodness that if we imagine actually eating carrot cake, like really allow yourself, if it needs to be a gluten-free carrot cake or like a non-dairy carrot cake, like make the carrot cake whatever's going to take care of you in this moment, and just imagine carrot cake bliss. And then just how do we then like apply that to how can we like serve carrot cake to our Ed partners, right? Like, let's just all eat carrot cake and try to find a way to kind of work together nicely. So that's that. I'll end it there on the carrot cake note, Christy.
Thank you so much, Bhagavati. This was so great. So really appreciate your time and everybody for coming. Bhagavati, I think maybe you and I can touch base maybe and circle back on the notes. And
yeah, we did a lot. And like I said, please do capture this chat, because I don't know why Zoom won't let us copy and paste. But I feel like there was a lot of amazing conversation and ideas that surfaced that I don't want to lose track of. And I appreciate y'all kind of playing along with me as I co-create these documents that we could kind of real time start building together. But I feel like this is just the start of a beautiful partnership to help align these systems. So thanks for all the work you're doing. And if you ever want to talk about workforce wellness, I'm here for it.
Thank you, Bhagavati. All right, everybody. We will see you next time. Our May Learning Collaborative. We're going to hear from partners of the Oregon School-Based Health Alliance about some of the work and outreach they've been doing around youth engagement. So mark your calendars. We will see you then. Hope you all have a great afternoon. Take care. Bye-bye.
Thank you.
Bye.